by Governor Janet Mills, Commissioner Gene Wambrew of Maine's Department of Health and Human Services, and Commissioner Heather Johnson of Maine's Department of Economic and Community Development. We're here today to provide everyone an update on COVID-19 across the state of Maine for today, Tuesday, October 6th, 2020. I'll begin by providing some of the updates around COVID-19 from an epidemiological perspective and then turn things over to Governor Mills. Right now, across the state of Maine, there are a total of 5,565 cases of COVID-19, an increase of 20 cases since yesterday. Of those, 4,983 are confirmed, an increase of 20, and 582 are probable cases, the same number as it was yesterday. Cumulatively, 457 individuals have been hospitalized, and right now in Maine, 7 people are currently in the hospital, one of whom is in the intensive care unit and none of whom is on a ventilator. In the past 30 days alone, 29 people have been hospitalized with COVID-19 across the state. 142 individuals have passed away, the same number as it was yesterday, and a total of 4,838 have recovered, an increase of 31 recoveries since yesterday. Among our cases are 1,076 healthcare workers as well. I'd like to turn next to provide a few updates on some of the outbreaks that Maine CDC is currently investigating. This morning, Maine CDC opened an outbreak investigation into the Applebee's restaurant in the Auburn area after detecting a total of 3 cases among staff members associated with that establishment. There are a number of open outbreak investigations that are currently underway as well. At the Pinnacle Healthcare and Rehabilitation Center, we've identified a total of 16 cases of COVID-19. And at ND Paper in Rumford, a total of 24 cases right now. ND Paper is gearing up for its 3rd round of universal testing, which will occur later this week, currently planned for Thursday and Friday of this week, after which time we'll have another round of results that our epidemiologists will analyze. Also, at the Woodland Pulp facility in Baileyville, there are a total of 19 cases that have been identified. 7 of those cases are among Maine residents, and 12 of those cases are among residents of other states. Next, a brief update on where things stand with testing across the state. Right now, the 7-day positivity rate across the state of Maine is at 0.58% statewide. Again, for context, the nationwide positivity rate right now is 5%. In terms of testing volume, right now in Maine, we are conducting roughly 437 PCR tests for COVID-19 for every 100,000 people in Maine. To put that number in context, the nationwide average for testing volume is 283 tests per 100,000, and the rate in Maine is 437 tests per 100,000. And finally, a quick update in terms of milestones. Something that we haven't touched on in a little while is PPE. Now, even though I haven't mentioned or provided updates on PPE distribution, it has very much been continuing in the background for the past several months. Indeed, even before the first case of COVID-19 was recorded in Maine. Our public health emergency preparedness team has continued to do yeoman's work, making sure that healthcare facilities, healthcare providers, first responders, nursing facilities across the state of Maine continue to have adequate supplies of PPE. They recently crossed a threshold. They recently delivered their 2.6 millionth piece of PPE. That is to say, the Maine CDC's public health emergency team has now delivered more than 2.6 million pieces of PPE to healthcare providers across the state. To put that number in perspective, that is 2 pieces of PPE for every person in Maine on average. That just goes to show that the amount of work that has continued to occur to ensure that healthcare providers and facilities have what they need to quickly respond to cases of COVID-19 and keep their patients safe all throughout that process. So I'd like to take a second to thank the Public Health Emergency Preparedness Team with support from the National Guard, the Maine Emergency Management Association, and the Maine Department of Transportation to make those PPE deliveries happen and to keep them happening. With that, Governor Mills, I'd like to turn things over to you. Governor, we're not able to hear you. And so it may be one of those things where if you hit your mute button and unmute it again, that might get us back. All right, we'll get the governor's audio back online ASAP here. Thank you all for bearing with us. We'll get the governor's audio back up and running in just a moment. While we're waiting for the governor's audio to come back online, I'll share a little bit of some of the work that we've been doing around contact tracing within the Maine CDC lately. We continue to have a team of approximately 100 people that are involved in both investigating cases and the contact tracing that follows them. We try to keep tabs on how we are doing as a contact tracing unit. And so I just will take a moment to provide a little bit of data on where things stand with contact tracing across the state. Our goal is within every single circumstance to try to reach every newly diagnosed person in Maine on the day that they receive their diagnosis from their healthcare provider. We're able to do so in the bulk of time, and we've got some new data on that we will soon be putting on our website. So please stay tuned for those data.
Hi,
Governor Mills, we'll turn it back over to you.
Can you hear me now?
Yes, we can, Governor.
Oh, good. All right, I had to close out and open up again. Technology and I do not always mix well, so thank you for the update. Folks, at the outset of the COVID-19 pandemic, I joined governors across the nation in issuing for Maine a stay-at-home, stay healthy at home order that required Maine people to stay at home as much as possible to mitigate the spread of this dangerous virus. I tell you, that was one of the most difficult decisions I've ever had to make during this pandemic, especially. You know, no governor runs for office thinking that one day they'll simply shut the state down and tell their neighbors to stay home and tell businesses to close their doors and families to postpone large gatherings. And like all Maine people, I wanted our state to reopen as quickly as it was safe to do so. I've always said that. And in April, because Maine people did stay home and did adopt health and safety precautions and did protect themselves and their loved ones, the spread of COVID-19 did start to slow down in Maine. While our focus remained on protecting Maine people from this deadly disease, we could then begin planning to safely reopen parts of our pre-pandemic lives and reopen our economy. Our plan to restart Maine's economy gradually eased restrictions on certain businesses and activities while also implementing protective protocols along with broader health and safety measures to help keep people safe. As of today, Maine has reopened the vast majority of our economy while maintaining one of the lowest rates of COVID-19 transmission. As of October 3, Maine, adjusted for population, ranks second lowest in the nation in terms of positive cases, fourth lowest in the nation in number of deaths, the lowest in terms of patients ever hospitalized out of the 36 states reporting, and the 9th highest in percentage of people who've recovered out of the 45 states reporting. So far, we have balanced public health with economic health, although it has been pretty difficult and it's been painful for many businesses and individuals. As the winter approaches, we have to continue this important balancing act. And we need now to ensure that the businesses who were able to operate outside safely during the summer months are able to continue operating as the weather gets colder. So today I've signed an executive order, and I'm announcing that beginning next Tuesday, October 13th, Maine will move into stage 4 of our plan to restart Maine's economy. So beginning October 13th, a week from today, businesses and organizations that serve people through seated activities, seated indoor activities, indoor dining, religious gatherings, movie theaters, for instance, they will be allowed now to operate at 50% of their capacity up to a maximum of 100 people. In deciding to make this adjustment, Heather Johnson, our DECD commissioner, partnered and consulted with the Portland, Lewis and Auburn, and Bangor Chambers of Commerce, as well as Visit Portland and Visit Bangor Regional Convention and Visitors Bureaus, to establish working groups and teams with their restaurant members, and they all evaluated potential solutions for the fall and winter. What we heard repeatedly is that they would all like to open and operate at 50% capacity, no matter how large or small. We have updated the COVID-19 checklist for these businesses and organizations. We've posted them on the DECD website. Appropriate health and safety protocols like enhanced cleaning practices and the requirement to maintain 6 feet of distance between seating areas, all of that remains in full effect. For non-seated indoor activities, such as physical activity in gyms, that limit remains at 50 people. The outdoor gathering limit remains at 100 people. Stage 4 also establishes the reopening date for indoor service for bars and tasting rooms and distilleries as Monday, November 2nd. So to reopen, those establishments will commit to abiding by the newly posted COVID-19 prevention checklist for seated food and drink services. During the summer months, I also issued an executive order that required certain businesses in Maine's coastal counties and more populous cities to enforce the statewide face covering mandate. To accompany the adjustments we're making today for indoor seated service, I'm also expanding that face covering enforcement executive order. That is now required statewide for those businesses. And I also broadened the order, or clarified that the order covers for the mask mandate, covers places like private schools and local government buildings and state government buildings, along with restaurants, lodging, and retail establishments, in having their employees and clients, customers, wear face coverings. We know that face coverings have been proven to significantly reduce the spread of COVID-19. Businesses that violate the order are subject to enforcement themselves, including possible fines or loss of license. To date, state officials have issued fines, in one instance nearly $20,000, and more than 24 imminent health hazard warnings to organizations that have not abided by the health and safety measures that are meant solely to protect their employees, their customers, their clients, and the general public. We believe that this expanded capacity for indoor dining and indoor seating facilities, along with the continued health and safety precautions, will be a prudent step that balances public health and economic health. And we will continue to evaluate these steps on a regular basis and listen to the feedback of all appropriate industries and see if other adjustments may be made that will support business and still protect the public health. So while we're making these adjustments today, these measures should not lure any of us into any false sense of security. We have to remember this virus is still very much among us, and that wearing a face covering, staying 6 feet apart, avoiding large gatherings, washing our hands often, all those things are key to keeping Maine open and keeping Maine schools and businesses open and keeping Maine healthy. Maine people all worked together this spring, this summer, and early fall to ensure that we could leave our homes safely, get back into some echo of what life used to be. This winter, let's adapt again keep adapting, and keep staying safe. Thank you. Happy to answer any questions.
Thank you, Governor. The first question of the afternoon goes to Brian Sullivan from WABI.
Thank you, Dr. Shah. Governor Mills, just going through this release about stage 4. I guess if you could, you talked about it a little bit, but why is now the time that you think this is the right time to do it, and just that balance of safety and also the economic part of it as you head into these winter months, and that outdoor seating that some of these restaurants had come to really rely on probably goes away? Is that a motivating factor with this expansion?
That is certainly one of the motivating factors indeed. A lot of these establishments, not just restaurants, but churches, have been for the most part, very, very compliant in allowing drive-in, drive-up services, outdoor services, and outdoor dining, outdoor activities. And the towns and cities have been very, very cooperative in allowing sidewalks and portions of streets to be closed and to allow the businesses adjacent to those streets to use them for customer service. So now that's getting harder and harder. And we know, knowing a Maine winter, it's going to get even harder. So we want to accommodate that need to serve clients and customers, and to allow these businesses to make money, and to allow these institutions to serve their customer base and their congregations and whatnot. But at the same time, maintain checklists and guidances that keep people apart and safely distanced, and the mask requirement, enforce the mask requirement. So it's a balancing, but yes, the weather is one of the primary motivating factors.
And Dr. Shah, question for you, and if anybody else wants to chime in, I'm going first. So I guess I'll ask you about President Trump and his recent diagnosis. And he tweeted, I think yesterday, he said, "Don't be afraid of COVID." And they've developed some great drugs for treatment. What's the president getting for treatment that a 74-year-old in Maine isn't getting? And has the treatments advanced to a point where you can be safely released from treatment? I'm sure being treated still, but really released from a hospital 4 days after being admitted, and just the advancements in treatment, I guess, would be my question.
Sure, Brian. We'll start with the piece on the drug cocktail that the president received. 2 of the 3 drugs that President Trump received are in widespread use across the country, including in Maine, and one of which is a newer drug, a drug called remdesivir, that many folks who have tuned in for many months now have heard us talk about before. It's a drug that recently received emergency authorization, and it tamps down on the virus's ability to reproduce within the body. That's a drug that Maine has received from the federal government, and we've distributed to hospitals across the state. The other drug that President Trump received is a steroid, a very powerful steroid called dexamethasone, which tamps down on what can sometimes happen in people with viral illnesses, which is an overreaction by the immune system. Both of those drugs are in wide use across the country, as well as in Maine. There's a third drug that the president received on Thursday or Friday, which is an experimental treatment of a cocktail of antibodies that are made in a laboratory that are designed to boost or mimic the body's own antibody response. The president received that under a compassionate use authorization. So the data around the total efficacy of that drug are not well known. That's not a drug that has yet received emergency or proper FDA approval. So we don't know to what extent it's being used in Maine. But the former 2 are widespread and are used in hospitalized patients. Brian, you asked about the president's discharge. I can't comment on that. That would be something for his physicians. I will note, however, that the president was discharged to the White House, a facility that has robust medical facilities within it. But in terms of the propriety of anything of that nature and his discharge, that's something that his physicians would be able to speak to, not me. I'm going to turn to Amy Brown at WERU.
Thank you, Dr. Shah. Now that the CDC, this is a question from a listener who is wondering about saying, now that the CDC has re-acknowledged the existence of aerosol transmission indoors, is 6 feet of distance actually enough of a buffer to prevent transmission of the virus in public spaces? And again, it brings up that question of, if I'm wearing a mask, do I still have to maintain 6 feet of distance?
So Amy, I think the CDC itself acknowledged that question in the document that they put back on their website, which is to say that although aerosol transmission is something they acknowledge, it's something that has been acknowledged in the scientific community for many months now, it still represents a small fraction of all of the disease transmission of COVID-19 out there. Indeed, if aerosol-based transmission were more widespread, we would see a much different pattern of transmission than the one that we actually do see. We would see something far more akin to measles, which has quite widespread and aggressive transmission. So even though the CDC now, quote, officially acknowledges it, it's important to note that scientifically, as well as within Maine CDC's operations, we've acknowledged it and accounted for it as we were doing case investigations and contact tracing for months now. In terms of whether the 6 feet margin is sufficient, all the best evidence right now suggests that it is. But as with any scientific endeavor, we may learn more about transmission and thus have to adjust. But what we know right now suggests that although there are instances where individuals have been infected at greater than 6 feet, they do seem to represent the minority. Now the question is, how significant is that minority? Based on what we know right now, it remains a minority. If we see greater evidence of longer term transmission, then the 6 feet might have to be revisited.
So the 6 feet is assuming that you are not wearing a mask?
So the bottom line here is that where possible, both wearing a mask as well as maintaining 6 feet of distance are the optimum. Droplets are, which is the predominant mode of transmission, are not thought to travel much beyond 6 feet. They are very large and heavy and tend to fall out of the air soon after somebody emits them, whether by coughing or by sneezing. That being said, where possible, the best public health advice is to wear both a mask and maintain 6 feet of distance.
Great, thank you. And my second question is, could you just give an update? I think you started to touch on this last week, of how many total outbreak investigations there have been, how many are currently active, and how many people that encompasses?
Sure, we can provide all those numbers for you, Amy. The number of cumulative outbreaks that we've investigated, it tallies well into the several hundreds related to COVID-19. Right now, again, we can get you the list of open outbreaks, or at least the number of them, and the case counts for each of those. It does vary greatly day to day, week to week, as new outbreaks are detected and then other outbreaks are closed. So that list does fluctuate, but we can certainly get you what we've got.
Great, thank you.
I'm going to turn now to Joe Lawler at the Press Herald.
Yes, I have 2 questions for Governor Mills. First question is, Trump tweeted this morning, or it might have been last night, about the flu being more dangerous than coronavirus. And I know we know that that's incorrect, but beyond that being incorrect, what do you think of him, continuing to, say the flu is more dangerous?
Sorry, Gov, you're on mute there, Gov.
I'm sorry, I said, Joe, I don't think anyone should rely on Donald Trump for their medical advice.
Okay, thanks. And my follow-up question is, I know you're allowing bars to reopen as part of this. And, research is showing that, bars are a somewhat risky endeavor. So that being the case, does that mean winter high school sports, as long as they, basketball, indoor track, et cetera, as long as they abide by the gathering size limits, that those are also likely to be green lighted?
I'm not sure what sports have to do with bars, Joe. I didn't quite follow the sequence there. But sports are school sports and community sports are regulated by a different guidance.
Sure.
And those rules have not changed.
Yeah, and we are in the fall sports season. We are reviewing what other states have done, what do we know about indoor winter sports right now. We plan to be meeting with the Principals Association and school boards and the superintendents shortly to begin the process of working on that guidance. We do have, again, some guidance posted, but we recognize the fact that it needs to be more detailed for winter, so that is in the works.
Just to clarify, does that mean it looks like we're going to have winter sports?
In the same way that we've approached fall sports, which is we do have fall sports, just in a different way than we've had before, our goal is the same. How do we allow children, students, other people to engage in sports in a safe way? So right now we're working on the same types of protocols that we worked on for the fall, and we hope to do that arm in arm with our leaders in the different associations.
I'm going to turn now to Allison Ross at WMTW.
Hi, thanks so much for taking my question. So just back to the timing of this reopening, we are seeing some of our neighboring states like New York, New Hampshire, and New Jersey, they're seeing an increase in the number of cases. We're also having more tourists coming into our state with fall foliage. Again, just going back to the timing, so is now the best time with a lot of these out-of-staters coming and other surrounding neighboring states seeing more COVID cases?
Let me take a stab at that first, and thank you for the question. I think we looked at what other states are doing. We looked at the capacity limits that New Hampshire, Vermont, Massachusetts, and Connecticut have for restaurants, bars, fitness centers, and churches. We think we're reasonably consistent with those states. We are keeping an eye on the progress of other states and any outbreaks that result from opening or reopening too quickly different facilities. Or outbreaks can be related to any number of different causes, not necessarily to opening a dining area or opening a particular kind of facility. But we're watching that very carefully. And I think let me add you've observed correctly that we do see an influx of tourists at this time of year. I myself, traveling up and down 95 and the Turnpike, 295, see a lot of out-of-state plates. I think that's been fairly consistent, though. Over the summer, we saw a lot more, and we're seeing people come here and stay longer, which is a good thing. We welcome them, I think our guidelines have served their purpose and are continuing to serve the purpose of keeping people healthy, whether they're from Maine or coming to Maine or dining in Maine or going to church in Maine. We'll continue to look at that day by day, week by week.
Thank you.
Thank you.
I'm going to turn now to Cindy Williams over at News Center.
There we go. Hello, can you hear me now?
Go ahead, Cindy. Yep.
I know we already addressed the school sports question, but I just wanted to say the Portland superintendent in the paper this morning said that state and Maine CDC guidance has been a little fuzzy on exactly how far away students need to stay from each other while in school. Is that something you could clear up right now, or are the new guidelines that are coming out going to address that more specifically?
Go ahead. Yep.
Yeah. So we worked very closely with the Department of Education as well as clinicians, public health advisors, and looked at the American Academy of Pediatrics guidance. And what they say is, for the purposes of school, in classroom learning, it may be possible for students to stay 3 feet apart rather than 6 feet apart. All that said, that guidance is clear for adults. Children should stay 6 feet apart from adults. Teachers should stay 6 feet apart from teachers. And when at all possible, maintain that 6 feet. So that guidance has to date held. We are not intending to change that. All that said, we work day in, day out with our partners in schools, working with, figuring out their spaces, trying to help them implement this guidance in a way that works for their school settings.
I'm going to turn next over to Evan Popp at the Maine Beacon.
Hi, Dr. Shah. Thank you. My first question is for Governor Mills. Governor, a number of states, including Mississippi and Georgia, have allowed absentee ballots to be counted if postmarked by Election Day. So given the reported issues with the Postal Service, is Maine considering moving our deadline for absentee ballots to postmark by Election Day?
Thanks for the question, Evan. There was a whole day of testimony presented to Justice Stokes just a week and a half ago on that very issue, in good part on that issue, and some other issues relating to elections. He determined that a person's constitutional right to vote was not at risk by virtue of the current statutes, which included statutes that require that you get your ballot in before 8 p.m., by 8 p.m. on election day. We've been very carefully watching that. Maine is party to a case in Pennsylvania, one of two cases nationwide, where a federal judge has actually issued an order to the post office to prohibit delays and to make sure that ballots in particular get delivered on time. Justice Stokes heard all that evidence, and I have no reason to dispute his findings in that area, but we're keeping an eye on things. What we have done is to move up the date when election clerks can start tabulating the absentee ballots so they don't get overwhelmed in the last week before the election. We've moved up the time when people can vote in person without any excuse or reason, to up to 2 business days before the election. We've changed some regulations and allowed, I think, a safer polling place for people who work at the polls, and still maintaining the 50-person limit and the 6-foot distancing, and all the other health and safety regulations that apply during a pandemic of this sort. And the other major thing we've done is to work with the Secretary of State and the community colleges in designing and having manufactured drop boxes for ballots. Those drop boxes are getting out now into the communities for those who don't already have them, who want them. And so a person, instead of buying postage or going to the post office, dropping off a ballot in the envelope signed by the voter in the post office, they can just drop it off any time of day or night without postage in a drop box under the close supervision and unique scrutiny of the clerk. And those ballots will be secured. They'll be emptied routinely by the clerk and one other person, 2 people at a time. I think our regulations along those lines will see that will help us keep the polling places safe and respect the constitutional right to vote. I know that both parties are encouraging people to vote now. Yesterday was the first day of actually absentee balloting. People are sending in ballots in droves, and that's a good thing for democracy.
So Governor, just to follow up on that, I know you mentioned the USPS part of that and prohibiting those delays on ballots. But say, for instance, someone mails their ballot on election day and it arrives after that election day deadline. Is it your view that that ballot should be counted or not?
If you mail the ballot on election day,
or if it's postmarked, the day before election day or postmarked on election day, and it arrives to the clerk after election day, should that ballot be counted?
What the post office is saying is to be safe. Mail your ballot in if you're going to do it by mail, and you don't have to. If you're going to mail a ballot in, an absentee ballot, mail it in a week, at least 7 days before the election to be really sure. That's what they're telling us. They also said, they also told Justice Stokes that they may not even postmark, there may not be a postmark on an absentee ballot. Sometimes they gather them up and deliver them to the clerk without postmarking. So changing the postmark or gauging the effectiveness of a ballot on a postmark may be not an effective way to count the ballot. So at least at this time, I think the Secretary of State and we discuss this often. We're keeping an eye on things. But at this time, I'm not inclined to lift that law. We do want to let people to vote as early as possible. I'm sorry?
I'm sorry, Governor, did you have anything more
No,
to add?
So we're not inclined to lift the requirement that is fairly old that ballots be delivered by 8 p.m. on election day.
Thank you. And just a unrelated question for you, Dr. Shah. So since the recent outbreaks among members of the federal government, it's become apparent that government officials are considered essential workers and therefore subject to different testing and quarantining rules. So I was wondering if you could say what your recommendation for people who have jobs that require them to travel frequently to hotspots like DC would be.
I think our recommendations in this regard apply to anybody who is traveling to any area with higher rates of COVID-19 than we've got in Maine. And that is to say, while you're in that other area, make sure you're staying safe Make sure you're taking steps to limit the amount of exposure that you've got so that when you come back to Maine, you don't bring the virus potentially back with you. I'm going to turn over to Charlie at the BDN.
Yes, hi, Dr. Shah and Governor Mills. I guess this question might be for both of you or one of you, I'm not sure. It's what convinced you that it would be safe to open bars and restaurants in the beginning of November when they were the focus of a lot of outbreaks elsewhere in the country? And then relatedly, what are the special precautions that they'll have to follow on those checklists? I think my colleague looked on the website, but hasn't been able to find that just yet.
If they're not up now, they'll certainly be going up by the end of the day today. There are a lot of checklists, and I think we want to give those businesses and establishments time to consider compliance with those requirements. There probably are some bars and tasting rooms where it wouldn't be feasible to comply with all the requirements, public safety requirements. I don't know, but we want to give them time to look at that. And the timing is in part, tasting rooms, for instance, many of them were able to serve outdoors. That's no longer feasible or practical in the coming weeks and months. So that's one reason we looked at bringing them inside and allowing some fairly strict compliance measures, public safety measures to go along with that.
And I'll just add that the safety guidance that we'll be posting today is going to be a little different than what we've done before. What we're going to do is try to combine the guidance for restaurants, bars, houses of worship, other places with seated service, meaning that people come in and they sit down in groups separated by 6 feet in these spaces, because those rules are generally applicable. We don't want to create differences or loopholes that other organizations could follow through. But just to give a sense of it, we will, in the same way we said this to restaurants, we're going to say this to bars and other organizations. There can't be live singing. We know that singing does project droplets, as Dr. Shah has previously said, and causes some risk. No woodwind instruments, no open dance floors, and no other places where people can congregate standing. As we know, density and duration are the way that we see COVID-19 spread. So if a bar can operate like a restaurant, like other places that have been operating fairly safely, we welcome the opportunity to give them a chance to reopen. But should we find that there are problems with compliance, that we really can't see the same type of precautions working well in these facilities, we'll take action. But we will have that checklist that applies to all seated activity up in the coming days. We'll give these establishments some time to adjust and implement them while we continue to monitor our public health trends. Because as Dr. Shah has been reporting, we have seen some areas of concern here in Maine the past couple of weeks. We want to continue to make sure that those public health metrics are stable. And we're hoping that, again, November 2nd, those types of establishments can reopen the last sector of Maine's economy that has not yet reopened.
Okay, and just another question about the reopening. So I understand that there will be sort of stricter face covering rules at the same time as limits on indoor gatherings are kind of lifted. Given that face covering requirements have not been easy or widely enforced across the state, I mean, is there any kind of mixed message that could be sending where you're both loosening some rules, but then also ramping up some other rules that have not been, strictly adhered to across the state?
I don't think it's a mixed message. I think it's the balancing act that I spoke about earlier. Yes, we're allowing some greater capacity for indoor seated facilities, but we're also imposing the enforcement requirement on statewide on those businesses who were subject to it before, only in the coastal counties and Bangor and Lewiston. So we're reinvigorating, or I should say reinforcing the mask requirement. At the same time, we're allowing certain businesses to expand their seating capacity.
Thank you.
And the final question for the afternoon goes to Patty White.
Thanks very much, Dr. Shah. I have a question about moving to stage 4 that I think is for you. Can you tell us what benchmarks Maine needs to maintain to stay in stage 4? And I know you look at a lot of different metrics, but is there a certain kind of positivity rate or new case rate that you want to see us hold or not go above to stay in stage 4?
Yeah, I'm glad you asked that, Patty. It's something that our team has been thinking about, discussing a lot internally. I think for stage 4, what we think about that as maintaining the gains that we've made so far. Right now, we look at a few things as we're analyzing the data. We look at the daily number of new cases, the geographic distribution of those cases across the state, looking for areas of concentration as well as dispersal. We look at hospitalizations, certainly the number of people currently hospitalized, and then also, as I reported today, the number of individuals hospitalized in the past 30 days. And then, of course, positivity rate. We look at not just the aggregate positivity rate, but the number of days where our positivity rate was below a certain threshold, 0.6, 0.5, that type of thing. And I think for stage 4, it's really about consolidating, maintaining those gains. If we start to see slippage in any of those, that will be something that prompts our team from a public health perspective to take a look at. There's not, again, a single formula that we follow where, unlike in the early days where we had very, very clear metrics here, it's more about taking a look to see if on any of those we see signs that we're regressing, which could be a sign of worse things to come.
And in terms of reinforcing the mask requirement, was the motivation for that because some of the restrictions are being lifted, or was it was it more in response to just wanting to see more people across the state wear masks?
Let me answer, if I may, initially at least. Look, we adopted that enforcement mechanism for large stores and certain facilities in the coastal counties back in June, I think it was, because we were anticipating an influx of tourists, and we wanted to protect the tourist centers in particular, Algonquin, Kennebunkport, Bar Harbor, Booth Bay, et cetera, and the larger cities where tourists might be going, Bangor, Lewiston, et cetera. Now we've had cases in every county, including in recent weeks and months. The summer tourist season is over, and now we're seeing an influx of tourists, as someone mentioned earlier. Leaf peeping season, they don't just stay in the coastal counties or Bangor and Lewiston. They go all through the state of Maine, and it's hunting season and whatnot. So people are coming into the state and going all across the state. So I think it's appropriate to expand that enforcement mechanism to the entire state, to those businesses to whom it applies.
Great. Thanks a lot, Patty. And Governor, that was the final question of the afternoon. So I'll turn things back over to you.
Well, thank you. Let me ask you a question, Dr. Shah, and I didn't think to ask this earlier, but with the flu season coming on, and I just want to join the chorus here on this call and encourage everyone to get their flu shot. Does wearing a face protection or a protective face covering also protect you from the flu?
So, Governor, the answer to that is that we think it does, based on some data that we've seen coming out of the Southern Hemisphere. It looks like wearing a face covering has the added benefit of not just reducing COVID-19 transmission, but also other respiratory viruses, chiefly the flu. What we, as folks may know, the flu season is flipped, and right now, as we're going in to our flu season, the Southern Hemisphere is wrapping theirs up. And so we can get a little bit of a sense, looking at countries in the Southern Hemisphere, of not only what may be coming our way, but whether the public health interventions that we've been recommending, whether they have follow-on benefits. And from some data from Australia, as well as some other places, they saw lower rates of flu because of postulated greater face covering wearing. Yet another reason to make sure that everyone is wearing a face covering.
Thanks. I didn't mean to pop that question on you unannounced, but I think it does support the idea of having a statewide enforcement mechanism and reinforcing the statewide mask mandate. Thank you for the answer. Again, get your flu shot, give blood, stay healthy, stay safe. Thank you very much.
Thank you, everyone.